Refresh Bolivia is an entirely student-run nonprofit that serves low-resource communities in Cochabamba, Bolivia. Through the construction of an integrated health center and public health research, our projects have benefited over 3,000 individuals since our inception. My name is Alex Jomet, and I am a current executive director of Refresh Bolivia. Originally from Houston, Texas, I'm a rising junior at Harvard University studying neuroscience and global health. My parents and grandparents were each born in different countries around the world, motivating me to join Refresh Bolivia to address health disparities at the international level. In the midst of the ongoing pandemic, Refresh Bolivia has launched multiple initiatives, such as emergency food delivery to over 100 vulnerable families, a well-being manual for children that has reached over 5,000 users, and educational social media campaigns in Spanish and Quechua that has reached over 330,000 people. Since June 3rd, confirmed cases and deaths from COVID-19 in Bolivia have nearly doubled. With little access to protective equipment, Bolivians often lack the ability to minimize exposure. Similarly, many hospitals are also facing shortages and faults in equipment like ventilators. To respond to this growing need, Refresh Bolivia proposes a commitment to action, equipping Bolivia, PPE and ventilator part production in Cochabamba. We plan to provide educational materials for the production of face masks, face shields, and ventilator parts to repair faulty ventilators. Our commitment consists of 3 phases: research, creation of materials, and dissemination across Cochabamba by the middle of July. Our team has completed the research phase, which involved identifying affordable, effective mask designs with an optional filtration layer that could be made from easily accessible materials. After researching the use of 3D printers to produce PPE, our team plans to distribute ventilator parts and face shields to our hospital contacts, a model that has already been successfully implemented by US and European-based companies. Our team is now finalizing instructional manuals and videos for mask creation in Spanish. The manuals will include both low and high literacy sections, and we plan to work with an existing network of translators to produce versions in Quechua, a widely spoken indigenous language in Bolivia. After purchasing a 3D printer, we plan to coordinate the production of ventilator parts and face shields with an on-the-ground partner. Lastly, we plan to distribute mask materials and kits to community members, including cloth, scissors, and elastics. At a later date, we plan to distribute 3D printed materials to our hospital contacts and kits as well. With our existing workflow from other previously successful COVID-19 projects, we are confident in our ability to streamline distribution across the district. Our key contacts include Bolivian universities and medical schools such as Univalle, Bolivian NGOs such as Fundación Ducanchix, the local Ministry of Health, Bolivian newspapers and TV stations who have previously featured us, and social media, including Facebook and our website. With an effective, sustainable alternative to medical-grade masks, our project ensures protection of both community members and frontline workers. Additionally, with the production of face shields and ventilator parts, healthcare workers can benefit from increased protection while providing enhanced care. Without funding, proper execution of this initiative will not be possible. Seed funding will support the purchase of important supplies on the ground in Bolivia, including a laminator and photocopier, ensuring sustainability and mass distribution of materials, mask making supplies in bulk, and a 3D printer. Our commitment to action implements an existing model in a novel context. With resources in Quechua, our program is maximally inclusive, reaching out to communities that have been systematically blocked from improved outcomes. Our organization is uniquely positioned to bridge the work of initiatives in America with the needs of communities and frontline workers in Bolivia. At Refresh Bolivia, our team is both excited and grateful to serve vulnerable communities in this time of high need. To learn more, please visit refreshbolivia.com and follow us on Facebook at Refresh Bolivia.